So inflamm-aging, this is a term that's used a lot in the anti-aging community. I really think that it's an important term for all of us to kind of adapt because inflammation and aging really go hand in hand, as we'll talk about. So we're going to start with how to reduce inflammation and treat insulin resistance, but first we're going to really dive into the science. So just kind of know that you guys have seen some of this before, and some of it might be a little bit new and nuanced, but I'm hopeful that by understanding the science, this is going to really help you treat your patients. So let's look at this slide for a moment. So inflammation is not only triggered, but also stimulated by intestinal dysfunction. So we mentioned gut health as it being super important. DNA damage, if there's a chronic stimulus to DNA damage or it's not cleared, we can see that trigger an inflammatory response, or vice versa. Mitochondrial impairment, and then epigenetics. Certainly that there are changes that can happen to our genes that then upregulate or downregulate how genetic expression is modified if inflammation is present, particularly if it's chronic. So the really take home is inflammation is a primary driver of the aging process. And we want to manage that to be able to dive and help our patients with reduction of aging processes. So chronic inflammation and immune activation. So this slide there's a lot going on here, but let's break it down. So I know you guys already had lectures on inflammation. Cytokines, so these inflammatory molecules that basically are signaling. I'm going to call out some specifics that I think are really relevant. You'll hear them again and again. TNF alpha, IL-6, and IL-1 beta. So let's just look at this picture for a second. So you have the vascular space here. If there is an insult that's going on in the tissue, essentially there are certain signaling molecules that then go over to the vascular space and say, hey, there's something going on here, I need some support. So then you have this neutrophil infiltration, right? Neutrophils are part of our innate immune system. They start coming running over and start trying to help out. They're the Marines of our immune system. That also then recruits basically macrophages, monocytes, when they're in the vascular system, and then they differentiate into macrophages. That's this guy over here. And if you see over time an imbalance between the number of neutrophils and then the number of macrophages able to clean up whatever that initial stimulus was, we start to go into something called secondary necrosis. And neutrophils, essentially, they rupture their contents, and that triggers more inflammation to come in. So again, I know there's a lot of kind of technical pieces to this, but it's relevant because if that signaling doesn't get turned off, that's when we see things become chronic, and that's when we see more problems emerge. This slide is just another depiction of what we just talked about. I think that it just has a little bit more of a simplified version of what's going on. So NF-kappa beta, this is a really important molecule that I'm hopeful that you've heard of before. And if you haven't, I'm going to introduce it here. So NF-kappa beta is something called a transcription factor. And basically it comes in and it goes into the nucleus and it tells the nucleus to make specific proteins that are pro-inflammatory. And we just talked about a couple of those. So cytokines, TNF alpha, and interleukin IL-1 beta, okay, that then triggers more of this inflammatory response. So if there are certain signaling that are upregulating the production of that NF-kappa beta, then we are going to see this cascade. And this paper is actually quite old. This is from 1997, but this was actually something that was pretty profound at the time. Everyone's like, whoa, this is happening. And actually one of the reasons that we have a lot of biologics now that kind of target some of this TNF alpha. But for us, as functional medicine practitioners, we want to think about therapeutics, which we will get to, that are going to turn down that NF-kappa beta and help reduce this inflammatory cascade, or at least regulate it, right? Like if I cut my finger, I want an inflammatory response. I want to make sure my NF-kappa beta is coming on because I don't want to get an infection and have it become a problem. But I don't want that to go on for weeks and weeks. I want my immune system to be able to regulate itself. So that's kind of the take home, and it's an important concept to think about. So our take home point regarding chronic inflammation is it's stimulated by dysfunction in the immune response. So too much of a response is then too little regulation and resilience. So we really need those balances to be in place. I didn't put tolerance in here, but I'll mention it because lack of tolerance leads to autoimmunity, right? So we want to think about all four really. So what does that have to do with aging? So chronic inflammation silences longevity genes, right? So there's, again, genetic expression. So we talked about NF-kappa B. Let's just go back for a second. Being a transcription factor, okay? If that is happening, we're actually seeing an inhibition of then longevity genes that are going to help support our anti-aging mechanisms. This also accelerates telomere loss, and we'll talk about what telomeres are in a little while. And it increases our mitochondrial dysfunction, and then also stimulates our really important next topic, which is insulin resistance. So insulin resistance is really one of the most important topics you can talk to your patients about in regards to ways to support healthy aging. By addressing insulin resistance, we're basically mechanistically improving the ability for our cells to not only repair themselves, but also regenerate in some ways. So it's an important area, and if you're not already looking at insulin resistance, that is a main driver of a variety of different conditions, I encourage you to do so.